Hi everybody, this is a video about neurotransmitters and chronic disease. Just before I jump into the crux of the video, if you could take a quick second to just like or share or subscribe or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So the question today is specifically, why is there dysfunction in neurotransmitters with chronic illness, and what is the relevancy of these neurotransmitters? Dopamine, serotonin, acetylcholine, norepinephrine, GABA, etc. So good question. Haven't really had any questions about neurotransmitters previously, so it's fun to talk about something a little bit different. So in my thoughts around neurotransmitters and their dysfunction in chronic illness largely circle around the fact that, actually just before I say what I was going to say next, as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So in my experience, a lot of the neurotransmitter dysfunction that comes along with chronic illness can be related to neuroinflammation. We know a lot about the pathophysiological mechanisms behind which, behind a number of the sort of chronic health-causing issues that exist out there are. So mold illness, for example, we know what causes a lot of neuroinflammation. Borrelia, causal microbe for Lyme disease. If it gets into the brain, can cause neuroborreliosis. We know mycoplasma can affect the brain, Bartonella can affect the brain, Babesia can affect the brain, chronic viral infections can affect the brain, heavy metals that get into the brain or chemicals that get into the brain can affect the brain. We know that there are histamine receptors in the brain, so mast cell activation syndrome or histamine intolerance can contribute to neuroinflammation as well. And so when, to my understanding, when there is inflammation happening in the brain, it can, first of all, interfere with the synthesis and metabolism of the neurotransmitters. And in my clinical experience, it seems that in a number of patients, it kind of pushes the neurotransmitter balance into more of a neuroexcitability mode and also into a neuroinflammatory mode. So pushing, say lower levels of more like, feel good, calming neurotransmitters like dopamine, and pushing higher levels of, histamine is an excitatory neurotransmitter, but higher levels of dopamine and say norepinephrine and things like that. So more excitatory neurotransmitters. So it tends to kind of rev up the nervous system. And a lot of folks with chronic illness, they don't feel revved up, or with chronic infections, don't feel revved up, but from an energy perspective, but their nervous system sometimes feel really revved up and they can't sleep, and sometimes have muscle twitches and different things like that, where it's like the nervous system's kind of coming alive at inopportune times. The other thing to consider as well is, of course, anyone listening to this who is suffering with a chronic illness or is a loved one or a friend or family member of someone with a chronic illness knows that it's really hard on the head. It's really tough to not be able to do all the things you want to do, and to feel crummy and maybe be in pain and all these types of things. And so that's something that could also impact neurotransmitter physiology from it's just kind of sad and depressing, or it's anxiety provoking to be dealing with these health issues. So I think the link between neurotransmitter dysfunction and chronic illness is probably multifaceted, but simplistically, if we can reduce the inflammation, which is sometimes easier said than done. It's not just as simple as take a pill and inflammation goes away. We need to treat the root cause. We need to immunomodulate. We need to promote tissue healing. All the sort of multifaceted things I've talked about before in other videos. But we need to sort of address the inflammation, but then also as the patient's feeling better, then that will take away or help to start, mitigating the just feeling sad and anxious and depressed from, feeling so crummy. So get person feeling better, reduce inflammation. It's a recipe for better neurotransmitter function. As far as the relevance of the various neurotransmitters, different neurotransmitters do different things, but the relevance in terms of chronic illness really kind of ties into what I was saying earlier, where there tends to be, in my experience at least, more excitatory neurotransmitters and not as many kind of calming and say rejuvenating neurotransmitters. So it tends to be more dopamine, more norepinephrine, more epinephrine, more histamine, not as much serotonin, not as much acetylcholine, not as much GABA. So fortunately, there are strategies that we can use to help metabolize/break down and get rid of the excitatory neurotransmitters, and there are also things that we can work with to help boost up the calming neurotransmitters. Of course, there are pharmaceutical drugs that impact those different pathways. And in terms of natural agents, 5-HTP can help to boost up serotonin, liposomal GABA, which in my experience works much, much, much better than just regular non-liposomal GABA, can help to boost up GABA levels. Taking, say, phosphatidylcholine can potentially help to boost up acetylcholine levels in the body and in the brain, and working with things to help to metabolize those excitatory neurotransmitters. So, I mean, histamine has a number of different breakdown pathways. I have other videos about that. So if you're watching this on YouTube, or go to my YouTube channel, just search, on my channel for histamine, and there's several videos about that. But vitamin B6 in its active form, which is pyridoxal 5-phosphate, along with magnesium, along with S-adenosylmethionine, which is a byproduct of the methylation cycle, those can help to metabolize the excitatory neurotransmitters and kind of bring them down. But with a lot of those things, they can also impact other pathways in the body. So it is just, yet another reminder to ideally please work with your healthcare provider around this, trying to biohack your way through neurotransmitter metabolism pathways, like neurotransmitter related protocols. It can be pretty tricky, and if you misstep, it's just an area where folks can flare more easily than, say, with other areas in some cases. So just a little word of warning there. Anyways, I hope that answered the question. If there are any outstanding questions about this topic or anything else, just post in the comment section below, and I'll do my best to answer as soon as I can.